And welcome to the Shatkin First Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin. Today we're going to be upgrading Stephen's overdenture with 6 mini implants to a fix-on 6 restoration with 10 mini implants. So we're going to be adding 2 implants on each side in the posterior. He currently has 6 implants in place. In 2023 we stabilized his upper denture with 6 mini implants. Those implants are doing great. We've anesthetized him and we're going to be placing 4 more implants, 2 2510s and 2 2511s. So here's the 2511 implant we're placing here. Are you getting that? We like that sound. That's the 30 Newton centimeters of torque. And we got all the way to 30 and it stopped. Now we'll go to 60 and we'll put it in the rest of the way. He's got very good bone and he's had really good success with his implants. Okay. There's implant 1. We're going to do number 2 here with the 10 millimeter, because the sinuses get lower toward the back. So we're going to do the 10 millimeter implant. Can you see Lola? Yes. All right, so we're putting this implant in. And again, we've got 30 Newton centimeters of torque. And we're going to go to 60 now. And that looks fabulous. All right, so we've added 2 on this side. Now we're going to add 2 on the other side. We can't go back any further posterior because his sinuses dip down. So we're keeping them as close to the forward area as possible. One hole and 2 holes. We're going to start with the 11. I think it's a little more anterior. Let me see. Let me find the spot that I made. Is that it? Yep. Okay. Open. And again, it stopped at 30, so we're going to go to 60. We love that sound. All right, now the last implant, 10 millimeter. Okay, so they're all in. We've added 4 implants, so we have 10 total. I've already hollowed out the denture in those areas. Let's just make sure the denture still fits over there. No problem. Okay, and bite together. Yeah, okay. Eventually we got to get you some teeth in the bottom and the back. All right, so let's go ahead and put the housings on here. We're going to use the housings for now, and then we'll get them back in a week or so. Take his impressions for his fix-on 6 restorations. But right now I'm just going to put the 4 housings on, and I'll take a little bit of Alexa.
Alexa too.
Just going to pick those up with a little bit of Luxatemp for now, because this denture is a temporary situation. We're going to be getting him his new restoration soon. So I'm just going to use that to pick the housings up. I'm going to put this in. Okay, bite together. Feel good? Okay, just hold that like that for a couple minutes, okay? All right, so we've successfully placed 4 mini implants to the 6 implants he had already. With a fix-on-6 restoration, we like anywhere from 6 to 10 implants, preferably 8 to 10. And 6 is the bare minimum, but we really don't like to do it with just 6. We like to do 8 to 10. Fix-on-6 is, a misnomer because minimum is 6, but 8 to 10 is better. Just like people say all on 4, well, it's really all on X. It could be 4, it could be 5, it could be 6, it could be 10, it could be 8. But fix-on-6, we like to have at least 8 or 10. So that's what we did here, and we're just having them bite together. And once these come out, you could actually take the impression for the restoration if you'd like and have a wax bite rim made for next time, okay?
Okay.
So let's just do that. Open for me. Almost done here. Just give it another, here, just hold that, okay? We'll give it another minute or two to set up. All right, so we're going to convert him to a fix-on-6 restoration. So we're going to convert him to a fix-on-6 restoration, which is essentially this restoration here with no plastic. It's a roundhouse, and it can be made out of zirconia like this one with pink porcelain, or it could be made with Xantex material, which is our fiber-reinforced resin restoration, but this particular one is zirconia with porcelain. But it snaps in and it'll stay in all the time. He'll never take it out, except when we come to the dentist, we'll take it out a couple times a year to clean it. So we always offer our patients the option to upgrade. And what I do in my office is I just charge them the difference between what they paid the first time and the cost of the permanent restoration. So we charge them an upgrade fee. So I'm going to take that out. Oh, it didn't come out. Okay, that's weird. Why didn't it come out?
It didn't stick to the inside of the denture.
Yeah, that's weird. It didn't stick. So the Luxatemp didn't stick in here, which is a little interesting, but I'm going to just put it in there and we'll get it to stay. We'll put something in the lab to hold it in there. I'll go glue it in, and then it'll be fine. But go ahead and take his impressions now for the final restorations, okay? Okay, I just put a little bit of glue in those areas to hold the housings in there. All right, so thank you for joining me on the Monday Morning Minute. This is an easy conversion from overdentures to fix-on-6 restorations or even roundhouses if you wanted. You could add even more implants if you want to do a roundhouse, but in this case, I like the idea of a detachable roundhouse fix-on-6. Thanks for joining me on the Monday Morning Minute. We'll see you next time. Hi everybody again. So you just watched me place mini implants to convert a patient's full upper denture to a roundhouse fix-on-6 restoration. And that was a fantastic, quick, easy way to convert somebody from removable denture to a fixed restoration. Now I just want to quickly introduce you to a new product we have. This is one of my assistants, Alina, and our other assistant, Andrea, and of course my son, Dr. Jared Shatkin. You might notice we're all wearing these little rings on our nose. No, these are not piercings or anything. These are just little plastic rings that give off a beautiful scent. And Shatkin first decided to try these out. First, I tried it out with my own staff to see what they thought about these. Alina, what are your thoughts about this?
I think that they really help when patients have a foul odor coming from their mouth or themselves. It just helps us get through the job, especially when we're drilling teeth or taking out teeth with infections.
Well, dental offices don't really smell the greatest in general. Wouldn't you all agree with that? Yeah. You know, you got the smell of eugenol or crown preparations, extractions, things like this. So this is it's like an aromatherapy for each of your staff members and the dentist. I know Jared wears it quite often.
Yeah, I usually wear it with probably 75% of my patients, I would say. And
what flavor are you wearing right now?
I'm wearing the coffee. Smells like I'm at Starbucks. Pretty good. Yeah.
What flavor are you wearing?
White lavender. It's my favorite one.
Lavender?
Really
and you?
My favorite is the white lavender as well.
I'm wearing the mint, and it feels like my sinuses are all cleared up. It's really cool. So they come in these little single packets, disposable. The girls put it on in the morning and they can wear it most of the day. And if they want to replace it halfway through the day, they can. This is really a great addition to your practice. You know, nurses and dental assistants used to put drops of essential oils in their mask to mask the odor of the dental office, but these things are so easy. You just stick it on your nose, you don't even notice it. And patients don't even notice it, but you have the benefit of not having that smell in your nose all day long. And they're so reasonably priced. We're talking about 144 of these for $250. You know, it's a no-brainer. You should try it out. And what I want you to do is, if you want to try it for your staff, just call William or Fitz or one of our salespeople, and they'll be happy to send you a few samples of these to try and see what you think. But I think you're going to really like them. I think our staff loves them. Alina's our model. She's on the flyer. You'll see her in the flyer wearing it because she really
They're
loves
selling
these.
like hotcakes.
Call up today and order your Centera flavor mint, lavender, or cafe mocha. We'll see you next time on the Monday Morning Minute.
I'd also want everybody to know about our International Academy of Mini Dental Implants Symposium that's going to be held down in Orlando, Florida. It will be held at the Four Seasons Hotel right in Disney. And it's a beautiful, beautiful place. We got great prices on all the rooms. So bring yourself down, bring your staff, bring your family. It's going to be a wonderful 2-day event. It's going to be August 1st and August 2nd. And it's a beautiful time down in Florida. We're going to have a lot of fun. Most importantly, we're going to have 2 unbelievable keynote speakers. One, Dr. Robert Miller. Dr. Miller's lectured with us in the past, but he's an expert on LPRF bone grafting. He has over 3 decades of implantology and placing implants. He's very well-rounded, and it's great to hear and see what Robert has to say. And our other keynote speaker is going to be Dr. Ernesto Leon. We're excited to have Dr. Leon join us. He is from South America, over 35 years of implantology in Mexico. And not only is he an expert in occlusion, but he's also an expert in developing implant training programs throughout the country of Mexico. So it'll be great to have Ernesto join us and Robert. And I think you bring yourself and your staff, you too will find a 2-day educational experience like none other. And the best part about the Academy meeting this year, half price for all dentists. So we're talking that you can pick up to 16 CE credits for $695 if you're not an MD-ICA and $495 if you are an MD-ICA. And staff members come for $495 or $295. We look forward to seeing everyone down at Disney at the Four Seasons Hotel for the International Academy of Mini Dental Implants meeting. And we hope you have an unbelievable week placing mini and mono dental implants.